To the computer. So I am really excited to introduce Dr. Lisa Tritto. She is a board certified pediatrician and also fellowship trained in pediatric obesity. So we are so lucky to have you as part of Evora. You have such an awesome skill set. And I'm really excited to hear your talk. So welcome.
Yeah, welcome everybody. Nice to see you. So this is our third talk out of five. The last two we were mentioning earlier, the last two have been recorded and can be made available. And we also turn them into blog posts, which pretty much contains the same information, and you can access those on our website at Evora for Kids. Okay. All right, so tonight our plan is to talk about what causes extra weight, what kind of health effects we see from extra weight in kids. So you just learned, yeah, pretty much about me here. I did general pediatrics for over 20 years and left to specialize specifically in weight management for kids. I did a 1-year fellowship at the University of Minnesota, where I worked in weight management clinic with some of the best physicians in the field. So I brought all that great knowledge and energy with me to St. Louis, and I'm looking forward to helping and sort of just spreading the message about what weight is and what it isn't. So tonight we're going to talk about a few different things. We're kind of sciencey tonight. We're going to talk about something called the weight set point theory. We're going to talk about the biopsychosocial model that contributes to our weight. We're going to talk about the risks of having childhood obesity, and we're going to talk about the health conditions that can result from that. And then we'll have time for questions and answers at the end. So the set point theory. Our bodies are designed to maintain a certain weight range, and it's something like a thermostat in your house. It regulates our hunger, our metabolism, and how much energy we use, kind of resulting in our final weight. So if you think about it like a thermostat, our brain decides that we need to be a certain number of pounds or carry a certain amount of fat on our bodies. And when we try to override that by maybe eating less, exercising more, our brain will start to fight back and basically will make you more hungry or more tired or slow down your metabolism. So it can be quite the yo-yo, and which is why it's kind of easier to lose weight, but harder to keep it off. Just a little graphical depiction here. So if this is your fat mass set point, which we call it in science, it can be changed by hunger, like I was saying, and how our body uses energy, like how many calories we burn at rest. What our metabolism is, etc. And then when we lose weight, here's the compensation that happens, or the adaptation that happens. So we start being more tired and we are more hungry, and then our weight kind of creeps back up. Now this is really sciencey, but this is just to show you that there are many hormonal regulations that go into regulating weight. For example, in the stomach, there's a hormone that's called ghrelin. It talks to our brain and it tells us that we're hungry, that we need to store more energy. And the brain then sends its message out to the body, and all these things transpire. All these other hormones over here are actually trying to counteract the ghrelin over here. You can see how ghrelin is positive, meaning let's gain weight, let's store energy. And then the rest of these are negative, trying to say, hey, we have enough on board. Probably the most famous molecule over here is the GLP-1, which is the medication, the GLP-1 agonists that are acting like this hormone that we make. And then I'll just back up a little bit because I use the word obesity a lot in the talk here, but I don't really use it in the office, and it's not on the walls and it's not on our signs, and it's all about kind of reaching a healthy weight. And most people don't really like that term. And so we do tend to avoid it. Unless you prefer, then we can talk about it in that way. So instead, we use terms like weight or extra weight or shape or size when we're talking to children. And also, in general, we recognize obesity as a disease process, not as a character flaw. And so, along those lines, we use person first language, meaning we say a child who has overweight or a child who has obesity, not an obese child or obese adult. So, multiple factors going into making up our weight, and we try to identify these at your first visit and kind of point out what they are. So, biggest factor of all is our biology. About and these are some of the factors. So, genetics. 40 to 70% of our weight is determined by our genetics. There are over 200 genes that have been linked to obesity. There's something called epigenetics, which you may or may not have heard of. And these are like the instructions that tell our genes how to behave. An analogy is think of your genes as a recipe book, and your epigenetics are like little sticky pads that say, hey, let's use this recipe a lot, or let's not use this recipe at all, or let's modify this recipe. And epigenetic factors that influence how our genes are expressed can be things like if a child is born underweight or very large for age, they're more at risk for having obesity. If the mother gained an excessive amount of weight during pregnancy or had gestational diabetes during pregnancy, these can affect how our genes are turned on and off. There are hormone disorders, sort of not the hormones I was just talking about, those hunger hormones, but other endocrine disorders like thyroid disease, Cushing's syndrome, growth hormone deficiency. And these are much less common than people think. It's less than 1% of children with obesity have that as a cause. Other things you can think about in brain injury, right? So we're talking about how that brain is your thermostat. So if you have a tumor or you have inflammation in the brain or you have a traumatic event to the brain or radiation, that can interfere with our internal thermostat. We might be on medications that cause weight gain, like steroid medicines, psychiatric medicines, antihistamines if used too much. And there's even been thoughts that a lot of antibiotic use in childhood from frequent infections can also increase your risk. Sleep apnea, sleep deprivation, these are known to affect how we regulate our blood sugar. And even the bacteria in your gut. There are specific bacteria that are higher in people in their gut that are higher in people with obesity than somebody without obesity. So it's so very complicated. And even there's a virus that's been identified that increases your risk for obesity too. So we go back to our little slide here. You can see now how like genetics can like affect any one of these steps. So you could have a problem with ghrelin where your body makes too much ghrelin. That's actually a syndrome called Prader-Willi. Or you could have a condition where your body doesn't make leptin at all. That's extremely rare. but it can occur. And so you basically never feel full. So just kind of show you, come back to how and where biology can contribute. All right, so that's biology. So the next factor is psychology. We know that chronic stress increases cortisol, and that can cause us to gain weight. ADHD, it's very common in my patients. Children are more likely to have obesity if they have ADHD, and it goes the other way around. Children who have ADHD are more likely to have obesity. These kids can have impulsivity around food. They have sleep issues, which then affect their weight. And they have sort of a reduced sensitivity to reward. So they seek substances that provide quick, intense stimulation, like really delicious high calorie food or video games. Anxiety and depression. People will use food to cope with uncomfortable emotions. Autism is another thing that I see in my patients a fair amount. There's a couple of different types of scenarios with autism. Some children with autism are particularly picky eaters and they eat very few, generally highly processed foods that are high in calories. And then there are some other kids who seek food for stimulation. And so they're just sort of constantly putting things in their mouth. Trauma. I want to talk about trauma. I mean, things like psychological trauma, like witnessing abuse, suffering from neglect, PTSD, homelessness, these sorts of things put you at risk for higher weight. Then there's eating disorders like binge eating and something that we call loss of control eating. That is something that it's basically binge eating, but in children. So under the age of 18, it's where children have episodes where they eat just a very large amount of food in a short period of time. And then we also know that mistreating people that carry extra weight has shown to just make matters worse. You know, even physicians are to blame here that when a patient doesn't feel comfortable talking about their weight or is afraid they're going to get lectured about their weight every time they go into the office, um, they start to avoid going in. So not good. It makes matters worse. Anybody have any questions along the way here? Feel free to chime in. Okay. All right, so we've got biology, psychology, and finally we have our environment, which has changed dramatically over the last 50 years, right? We have food everywhere. Life is stressful. Our jobs are sedentary. And as you all know, there are people who do just fine in this environment, probably because they don't have the biological underpinnings or the psychological issues that affect weight like others do. So, as I said, sedentary lifestyles. What kind of opportunities do we have for activity? For example, we don't have gym class as often as we used to. Our kids don't. They don't have enough recess time. Sometimes you live in a neighborhood where it's not safe to go out and play. And so we are limited in that regard. Or perhaps a child is home by themselves because the parents are working late and they have to stay inside. So all sorts of different things can limit our ability to move our bodies. Our diet habits, maybe lack of knowledge over what is healthy and what's not healthy, can be a factor. What kind of food is being served at school? I've had patients, most recently I had a patient where at their school, the children are allowed to order at the beginning of the week from like restaurants for lunch every day of the week if they wanted to. So like Monday is Chick-fil-A and Tuesday is something else. Um, yeah, that's their opportunity there. When I was in Minnesota, children had breakfast for free in schools. And I had several patients who, while talking to the family and getting a history, learned that their kids were having two breakfasts every day. Parents had no idea that they were eating at home and then eating again in school. And usually the things that were being served in school were things like cinnamon rolls and juice and things that were high in sugar and not a lot of nutritional value. And then just kind of, society, like we use food as celebration. There are, lots of family traditions that center around food. And then there's even different cultural beliefs about what is and what isn't sort of a normal and healthy size. All right, just gonna fix something here. There we go. All right, so you have the background to understand the multiple influences of weight. So why do we need to help children with obesity? What can happen if it continues? So these are conditions that I'm going to talk about that occur in children, not just adults. And I've seen every one of these conditions in patients that I've treated. We'll start with diabetes. If my slide will progress. Yay, there it is. Diabetes is particularly worrisome in childhood. It is growing really rapidly. And if a child develops diabetes, it is a much more progressive and aggressive disease than when it starts in adulthood. So very, very, very important. Probably the biggest worry that I have about patients. Extra weight is associated with asthma, with sleep apnea, high blood pressure, high cholesterol, intestinal and gastric issues like heartburn and reflux, liver disease where fat deposits into the liver, otherwise known as fatty liver disease. It has another new name that's too long to talk about here. Children experience early puberty that are carrying extra weight. It's also associated with polycystic ovarian syndrome. Weight can cause depression, anxiety, eating disorders, and those things can also make the weight worse. So sort of a negative feedback loop there. And then muscle, bone, and joint problems from carrying extra weight. There are conditions that can be quite serious that affect our bones as they're growing because of the extra burden on their bodies. All right, so to review, extra weight creates physical challenges, metabolic challenges, worsens emotional and psychological well-being, and can also lead to social isolation. So many people say, oh, your child is just going to outgrow their weight. Well, that's a good question. Will they just outgrow their weight? Current statistics. This was before the pandemic. 1 in 5 children in the US had obesity. We're quite sure that it's higher now. We saw a huge increase, but I just don't have statistics to back that up. Children with obesity do tend to become adults with obesity, about 80%. Severe obesity rates are rising very quickly. And like I said, 80% of kids will likely become adults with obesity. And currently among adults in the US, about 40% of adults have obesity. There's been some projections like for just 5 years from now, actually, in 2030, that at that point, studies suggest that 50% of US adults will have obesity, and severe obesity will be in 1 in 4 adults. So really growing rapidly. Now, how all the new medications are going to affect that, I guess we don't know. So hopefully that trajectory will improve. Um, Statistically speaking, it's thought that the majority of children will have obesity by the age of 35. So it's a problem that's not going away. So what can you do to help your child? Create a supportive home environment. So this was the topic of our first talk, and you can read the blog about that. It's just about using language and making your home a safe space for your child. Providing balanced meals where you can, and limiting processed foods, at least in your home environment. And our second talk was about nutrition. So it was titled Teen Nutrition, but I think it's good for any age group. So feel free to take a look at that as well. Focus on a healthy lifestyle. Aim for 60 minutes of activity every day. And recess counts, and gym class counts. And it should just really be fun. It doesn't have to be organized. It could be a dance party in the living room. Doesn't really matter. If your child has mental health issues, you want to kind of get ahead of that. If you think they may have anxiety or depression or ADHD, like talk to your doctor and try to address these things before they become a contributor. Make sure your child is getting enough sleep, and if not, look for help. Teenagers are supposed to have between 8 and 10 hours a night, and I feel like not many of them do, at least not in my clinic. 6 to 12-year-olds are supposed to have somewhere between 9 and 12 hours a night, and adults between 7 and 9. Keep your regular well visits with your pediatrician. And if you're concerned about your child's weight, or you're not sure where they fall, but you don't really want to talk about it in front of them, you could ask them privately. Just about every pediatrician has a messaging system now where you could say, hey, where does my child fall on the growth chart? And of course, you can call our office and see me, and I can help you too. And next talk, we will go over what to expect at your weight management appointment visit, what it's all about. So about the team here, just so you know who we are, there's myself. We have Amanda Ratz. She's a therapist and motivational coach. She sees young kids up through adults. She's really just amazing. We have Audrey Miller. She is a dietitian, and she is also excellent. She was part of our second talk. And then Joni is both a pediatric nurse and a personal trainer that works with kids. And here is just the ways to reach us and find us. And I will open it up for questions here now.
So I just want to say thank you so much, Dr. Tritto. I personally love hearing your talks. I'm the gynecologist at Evora, and I also do weight loss for adults. And I just listening to you, managing kids is so different. It is such a different ball game than helping adults lose weight. So I think it's really important, especially with like the underlying biological processes, the words that you use, and how you approach activity as fun. It's just so important to see somebody who has your training and your background when managing kids. So I'm really grateful for all that you do.
Oh, thank you. Thank you very much. I really enjoy it. I love diving deep and really getting to know my patients, and just knowing pretty much, I feel like I know everything about their lives by the time they walk out of the office. Um, as we were just talking about, I have a questionnaire that I have families fill out, and I don't know, it's 6 pages, 8 pages long, something like that. And we really do kind of figure out where to focus our energy.
Yeah. Yeah, it's tough, and it pains me to think how obesity in children affects their mental health and all the bullying that goes on and how kids can be so mean. And
Mhm.
I'm glad also we have Amanda, who's a therapist for kids, just to help kids build self-confidence and self-worth. So important.
Yeah. I feel like a recurrent theme that I see in patients is they were bullied or teased about their weight. And honestly, they could have been at a normal weight when they were bullied or teased, but then they internalize that message. And so they start doing things like skipping meals because they think they need to lose weight. And that then leads to binge eating and overeating and craving the highly processed foods that are not so great for our bodies. I have seen that many, many times. Yeah, and it breaks your heart. Yeah.
How do you break that cycle?
That's a very good question. Um,
That's
a
good.
lot of building your child up at home and talking about health instead of weight and what our bodies can do instead of what they look like. And yeah, really intervening early on if there's any of that going on. And Amanda's really the expert in addressing bullying because she also used to work in the schools. So she's a superstar in that regard.
Yeah. Any other questions? All right. Well, we have recorded this and we will also turn it into a blog. So it'll be on our website, Evora for Kids. And we've got all our information up here, phone, all that.
Oh, yep, yep.
Whoops, that's okay. Well,
There it
back.
is.
Yeah.
There it is.
So if you have any questions, just feel free to reach out. We are available and we're here to help.